Good.
Okay. Oh, what is the priority nursing action when caring for a client with
Disseminated
disseminated
intravascular
vascular
coagulation.
coagulation?
Okay. Do you know what that is?
Uh, hmm, hmm, not really. No,
Okay,
I was like trying to put it together in my head what it could be. Uh,
you'll know after this. Look,
they're clotting somewhere.
well, it's not only clotting. This is the thing.
Okay.
Anytime you have trauma or a very acute, severe issue for the person, like sepsis, which is
Mhm,
a widespread infection, or like when you're bleeding out, like a mother who just gave birth, she's bleeding out,
mhm.
right? It's normal, but that type of stress placed on the body can cause this condition that we call disseminated intravascular coagulation. Disseminated means it goes all throughout, intravascular in the vessels, coagulation, clotting. It's disrupted. Let me explain.
Okay.
The first thing that you have to have like three things in order for, so you understand what the hell this is, okay? The first thing that happens, you have to have some type of trauma or acute issue like sepsis. Does that kind of make sense?
Hmm.
When you have trauma, when you have sepsis, you're bleeding out, you have tissue damage, your body starts to do what to that bleeding site? It starts to,
But it tries to make it clot, right?
yeah, it tries to make it clot. So when you have to have trauma, sepsis, then the second thing that happens in this condition is your body clots, but it clots way too much.
Okay.
Okay, it clots way too much. So you start developing blood clots everywhere on your hands. You may have
Okay.
pulmonary embolism, a stroke, a heart attack. It may obstruct the renal artery. You might go into kidney failure. Do you see what I mean by this?
Hmm.
There's something called, remember how I told you that vitamin K helps us clot?
Hmm.
Okay, vitamin K helps us produce something called clotting factors. And if you think about the whole clotting mechanism, think of like the cells that help us clot, the platelet, that's like the construction worker. The clotting factor is like the tools that we need for the construction worker to do his or her job. Does that kind of make sense?
Hmm.
So the platelet is the cell that helps us clot, but the clotting factor is a substance that we can't clot without it. That's what vitamin K helps us produce, by the way. Does that make sense?
Yeah.
Think of like the clotting factor also like the concrete that a construction worker, it takes time for it to dry, right?
Hmm.
So that's what's happening. So when you have this DIC issue, remember, first you have trauma, sepsis, you start bleeding. So your body clots, but it clots way too much. And since you're clotting a lot, what are you wasting? All of the clotting factors.
Hmm.
And so since you've just now the problem is this. You've used up all the clotting factors because you clotted everywhere, but the main area that was bleeding, it's
Didn't clot.
probably yeah, it's probably still messed up. So the third thing that happens is you start bleeding again. Okay? In a nutshell, this is disseminated, widespread, intravascular in the blood vessels, coagulation, but it also is associated with bleeding. Does that make sense?
Yeah.
Real quick, what are they missing?
What are they missing?
Yeah.
They're missing the vitamin K?
Well,
No.
yes. Yes, but specifically, what's it called? This right here?
Other clotting factors.
The clotting factors. There's different types. There's clotting factor 1, 2, 3, 4, 5,
Okay.
6, 7, 8, 9, 10, 11, 12. Von Willenbrand. I'm trying to get at it. There's a bunch of them. Okay. There's a lot of tools that we need for clotting. And yeah, they're being wasted, right? So when
Yeah.
somebody has this, you could also give them clotting factor
Okay.
afterwards. Does that kind of make sense? But it just
Hmm.
depends on where in the condition you start treating them. For instance, if it's right here when in the second part where they're clotting way too much, if you're giving them clotting factors, you're gonna clot even more.
Yeah.
So when they're clotting too much, what do you want to do?
Give them blood thinners.
That's correct. And that's kind of controversial because we know what's going to happen afterwards. They're going to bleed
They're gonna bleed
again.
again.
So you can give them like like something called enoxaparin, low molecular weight heparin, like diet heparin.
Okay.
So my point is that you're kind of like, okay, right now we're giving blood thinners. Okay, now we got to give the clotting factors. It just depends on where in the clot in the traumatic event this you're treating. Does that kind of make sense?
Mhm.
Okay. Now that we've established that, we got this question. It says, what is a priority nursing action? The priority nursing action when caring for a client with DIC.
Mm, uh, out of these four, I
Mhm.
guess four.
Apply sequential stockings. Okay, that's your final answer?
Yeah,
You don't sound too sure.
I'm not.
Okay, okay.
It's just a guess.
Remember, these patients, they
Okay,
bleed
is
out.
it one?
Monitor for home. What is Homan sign?
I don't know. That's why I didn't pick one.
Okay, let me tell you what this is. You know when
Mm-hmm.
somebody has a DVT, a deep vein thrombosis? You know what that
Mm-hmm.
is?
Yeah,
They have a blood clot in their calf muscle in the vein that's deep in there, right?
yeah.
Well, their calf gets like really red. It gets swollen. It gets very painful. And every time they dorsiflex, it causes pain. And the skin on the calf becomes very shiny because you have a clot in there, most likely. So a positive Homan sign, or when you're monitoring for Homan sign, you're monitoring for indications of a blood clot. Does that make sense?
Mm-hmm.
All right. So what do you think the answer should be? Are you still going with that one? That's fine
Yeah,
too.
I'll go with one. I'll go with
Okay.
one.
Let me explain to you why
Why
it's
is that
this
that?
one. No, but this
And
is
I
why.
was thinking about number two also. I just
But let me tell you why. Because you know all three of these things can happen.
Mhm.
Clot can happen and bleeding. But the reason why it's this one, first of all, it's your
Priority.
priority.
Yeah.
Priority means ABCs, right? But airway and breathing is not in here. Circulation is because avoid giving an IM injection because we know that they're gonna clot a lot. And then what's gonna happen? They're gonna bleed out. But how do we know which one? Because they're both problematic, right? If you have a blood clot of a stroke, but here's the trick of this question. If they're asking you for one answer, right? And two of the possible answers are essentially saying the same thing, those two are not it. And isn't a Homan sign a blood clot? And
Yeah.
isn't applying sequential compression stockings to prevent blood clots? So
Hmm.
because those two are essentially the same thing, you can eliminate them. And now this becomes your priority because if
Yeah,
you give them an
because
injection, you're going to bleed out right now, as
right.
opposed to a potential clot and a potential clot, because both of these monitor means you're looking out for future clots. Applying sequential compression stockings, you're preventing future
Future
clots.
clocks.
Do you see what
Right.
I'm saying?
Same thing.
And that's an NCLEX rule.
Okay.
You don't, when you're unsure, like, only in these circumstances, sometimes they're going to ask you to differentiate between two statements that are very similar, but it'll tell you. So for this one, make sure you understand that. The reason why it's this one, not only it's because it's circulation, airway breathing circulation, but monitor for homicide is just a future blood clot. Applying sequential compression stockings is to prevent a future blood clot. That's the part where we treat, okay, with this one is like, okay, priority. It's airway, breathing, and circulation. But let's say circulation is still not enough for this one. Well, this one and this one are both addressing future blood clots. Those two are the same thing. We can eliminate them. It's going to be this one.
Right. Okay.
It's a test taking strategy. You with me on that?
I am.
All right, cool.